Hi friends, my name is Dr. Shyam and in this video I will be discuss very high yield Neet PG MCQ. So here a 42-year male with history of alcohol use present to you with fever, jaundice and ultrasensorium. His bilirubin level was 17, INR was 3.8, creat was 1.7, serum ammonia was also elevated, IgM HEV was positive, BB was 90/60. Here question is asking which of the following is best define his current condition. So you should know difference between acute liver failure and acute on chronic liver failure. So you should know difference between ALF and ACLF. What are the criteria for define acute liver failure? First one is there should be no prior liver disease. There should no prior liver disease. And second one is there should be coagulopathy. It means INR more than 1.5, and there is hepatic encephalopathy. And there is a acute hepatic dysfunction present with jaundice. Okay, so these are the criteria for define acute liver failure. What is acute on chronic liver failure? It means ACLF. Acute on chronic liver failure, it means in any system, if there is a acute on chronic, it means there is a precipitating factor and pre-existing disease. Here is a pre-existing disease is CLD. Okay, chronic liver disease. If any patient with chronic liver disease, any acute insult lead to the precipitation of pre-existing disease. So acute insult in case of CLD could be infection or sepsis. Infection there could be hepatitis A virus infection, HEV infection, or acute reactivation of hepatitis B virus, or there is EBV, CMV, parvo, acute insult on hepatic cells. So always in pre-existing liver disease there is a acute insult on liver. So it is a defining criteria for ACLF, and it will manifest as jaundice, hepatic encephalopathy. Okay, so let's rule out one by one. Option A is acute hepatitis. In acute hepatitis, there is no liver cell failure, there is no coagulopathy. Here is a coagulopathy, here is a liver cell failure. So option A is ruled out. B is saying acute liver failure. For acute liver failure, there should no prior liver disease. But here is a history of alcohol use. So here is a case of CLD. And so option B is also ruled out. Option C is chronic liver disease. Chronic liver disease is there, but there is a acute insult on liver, that is hepatitis E virus insult. So rule out option C. Option D is correct option, acute on chronic liver failure. Why? Because there is a CLD and acute insult is hepatitis E virus, which lead to the acute insult is hepatitis E virus lead to the jaundice, altered sensorium and coagulopathy. So it is a case of ACLF.